Welcome to Health Matters. I'm Dr. Derek Da Silva. Nearly everyone in their lifetime will be affected by breast cancer. Unless a person is personally dealing with the disease, it can be hard to separate myth from fact. Joining me today to help clear up some of the confusion is Dr. Stacey Vitiello. She's a radiologist from Montclair Breast Center. Thank you very much for joining us.
Oh, it's my pleasure.
What are some of the myths that are still out there with breast cancer?
I think the biggest myth that we see on an everyday basis is women thinking that if they don't have a family history of breast cancer, that they're safe, that they don't need to have rigorous screening and do what they need to do to detect breast cancer early. 80% of the women that we diagnose with breast cancer have no family history.
Wow.
So, yeah.
That statistic is that, it's
Yes.
80%?
Yep. Mm-hmm.
That's just, I don't think I've ever heard something like that. And talking about statistics, what are the statistics that are out there?
Well, the risk for breast cancer in the American population is 1 in 8 women will develop breast cancer in their lifetime. That's huge. Men are also at risk for breast cancer. It's a small number compared to women, obviously. It's less than 1% of all breast cancer cases are diagnosed in men. And usually it's because they feel a lump. It's not a screening situation for male breast cancer.
And what about women? You know, I mean, we've all heard that they should do the monthly exams and go through that whole thing. Could you just talk to that a little bit and the significance of that?
Sure. You know, we've kind of developed at Montclair Breast Center the secret sauce of how to maximize early detection and save the most, not only save lives, but also prevent women from needing chemotherapy, which is huge. If you can find it early enough that it doesn't need chemotherapy, that impacts somebody's life in its entirety. So basically screening mammograms starting at age 40, earlier if the patient is at high risk, having a risk assessment by their doctor to determine if they're at high risk, and possibly if they have dense breasts, having a breast ultrasound or breast MRI in addition to the yearly mammogram.
All right. You know, this whole piece is so important, and I love what you mentioned initially about the whole idea of if you don't have a family history, don't worry about it. Still get screened. Thank you very much for the great information. A pleasure to have you here with us. And folks, once again, here's what we're working on for next week. And remember, you can catch Health Matters every Saturday and Sunday during our morning and afternoon newscasts. Once again, thank you very much for joining us here today. Here's a look at this week's Community Health Calendar.